And good day to you. I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome to this week's episode of Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your pain. Today's episode, migraines and headaches. It just doesn't matter. Now, in the last couple of weeks, we've actually presented a tiny bit of the decades upon decades upon decades of proven published medical research that supports the fact that your migraines and headaches may not be a head problem, but rather a specific disorder of the upper part of your spine, near where your head and your neck connect, at the base of your skull. And this has continued to be supported since the early 1950s, continuing till this very day. Yet, for whatever reason, and by the way, there are many, your doctor either has absolutely no idea, they are oblivious to this proven published research, or, boy, I hate to say this, but it's true, maybe they just don't care. Because it just doesn't matter. So, first of all, what doesn't matter? Well, number one, it doesn't matter what kind of treatment, what kind of therapy, what kind of doctor, what kind of therapist. It doesn't matter where you seek help for your migraines and headaches until you first know what the real true cause of your symptoms is. So, we discussed in episodes past what is a true diagnosis versus a false or a medical diagnosis. And a medical diagnosis is simply the regurgitation of your symptoms right back at you. So, if you seek help at your primary care doctor, your chiropractor, your pain management specialist, the neurologist, the vast majority of the time, even after extensive testing in some cases, which, as I know from my personal experience, and you may likely know, usually is seemingly normal. It does not identify the cause of your migraine and headache symptoms, and we kind of scroll down our medical records, and under the section that says, "Here is your diagnosis," it says, "You have migraines." What? I went to your office seeking help, telling you that I'm having migraines. You now tell me that I have migraines. That is not a diagnosis. That is a typical medical or false diagnosis. Puking your symptoms right back at you, telling you that's a diagnosis. Absolutely not. A true diagnosis is what is going on inside of your body right now that's causing your migraines or headaches to return time and time and time again. That would be a true diagnosis. So, this is one of the simple concepts I want you to understand today. If you don't know what you're trying to fix, you're never going to find significant and certainly not long-lasting relief from your migraines or headaches. So, it just doesn't matter what kind of a doctor, therapist you see, and it certainly doesn't matter what kind of treatment or therapy you try if you don't know what the real true cause is in the first place. Commonsensical medicine in action. Next, in many cases, your doctor's quote-unquote professional opinion just doesn't matter. And the reason your doctor's opinion may not matter is, we've discussed in many episodes in the past few years what I call specialty goggles. And specialty goggles are your doctor's limited ability, your chiropractor's limited ability, your therapist's limited ability, your neurologist, your pain specialist, their limited ability to only see your migraine and headache symptoms through their specific training, and the treatment that they happen to provide is what they are trained to provide, whether it addresses the cause of your symptoms or not. This is one of the biggest challenges. It was certainly one of the biggest challenges for me when I was seeking help for my migraines, and it continues to this day, almost 40 years after I was able to get rid of my migraines once and for all. We end up on the merry-go-round. We try this and try that and try this and try that. And our doctors try this and try. We're guessing. And if you continue to guess with your health, if your doctor continues to guess by simply trying things out, hoping somehow that's going to give you some kind of significant long-lasting relief, you're doomed. If you don't know what you're trying to fix, you're never going to get the significant long-lasting relief that you deserve. So, number one, it just doesn't matter what kind of treatment or therapy you try until you first have pinpointed with certainty the real true cause of your symptoms. And secondly, your doctor's professional opinion may not matter because they don't know what the real true cause of your symptoms is. So that is simply guessing, and I can promise you this, I will never guess when it comes to my patient's health. Never. So, the last couple of weeks, I've been presenting just a few of the published medical research and clinical studies that continue to show and prove that the most common cause of migraines and headaches of many types is not a problem inside of your head, but rather specific upper spinal disorders. So, since we're on that line of thinking, I'm going to present a couple more of those here today. The Journal of Occupational Trauma, another peer-reviewed journal, which concluded headaches of many types are more frequently caused by spinal stress than any other condition. What? Spinal conditions causing migraines and headaches. That is something that's been published, proven for the 80 years almost. 80 years of proven published medical research pointing to specific upper spinal disorders as the primary, not a secondary, a primary cause of headaches of all types. Yet, once again, why do our doctors, why do headache and migraine specialists seem completely oblivious to this proven, published medical research? It's baffling to me. How are our headache specialists, how are our doctors supposed to help us find a long-term solution for our migraines and headaches when they have absolutely no idea what the cause is? Kind of scary. Let's do one more here today. This is out of a very, very well-known and respected medical journal called Spine. And Spine has concluded in a specific, proven, published medical research study, ready for this? Anatomical, physiological, and clinical evidence exists, which indicate that, listen to this, disorders in the structure of the spine are a frequent cause of headaches. So, in both of the published medical studies that we're quoting today, they each are saying the same thing, and that is, headaches don't happen periodically because of an upper spine problem. They don't happen occasionally because of an upper spine problem. They happen frequently, directly, and primarily as a result of upper spinal disorders. So, this is one of the most, okay, it is not. It is the most frustrating thing for me in day-to-day practice. I had an experience just in the last week in my private practice of nearly 32 years so far, in which we were able to identify with complete certainty. It is glaringly obvious by looking at a simple X-ray image of the upper part of my patient's spine what the cause of her migraine symptoms is. Because, after all, it's been published in nearly 80 years of proven published medical research, number one. And number two, it is glaringly obvious not only to me, but to anyone that simply will take a look. If we were to put a quote-unquote normal X-ray picture with the normal structure and normal shape of a human spine, and then put an quote-unquote abnormal X-ray, in other words, an X-ray that clearly identifies a problem that frequently, as the medical research says, results in migraines and headaches, it is obvious to anyone who's willing to open their eyes, use a little bit of common sense, and take a look. And, as a matter of fact, with this particular patient, she, in her mid-20s, has one of these, I would venture to say, one of the most severe cases that I have seen in the past 12 months. Yet, the board-certified radiologist that looked at her X-ray picture said, everything appears normal. How can this be? How can we have an X-ray that has a glaringly obvious problem, and that problem continues to be documented as a primary cause and a frequent cause of migraines and headaches, yet the radiologist says this X-ray is unremarkable, it is essentially normal? How can this happen? Well, specialty goggles. So the radiologist is trained to look at the X-ray for acute pathology. Or, in other words, did this patient have any broken bones? Well, no. Well, did this patient have any obvious signs of cancers or tumors? Well, no. Therefore, the X-ray is essentially normal. So, the radiologist, the medical radiologist in particular, is specifically trained to look at an X-ray for abnormalities of the bone structure, damage to the bone structure, and in absence of that, the X-ray is automatically categorized as essentially normal. They are not trained to evaluate the spine for normal shape, structure, and alignment. That is not part of a medical radiologist training. So it's frustrating for me when people have had an X-ray picture done, after MRIs or CT scans have come back essentially normal, showing no signs of a true cause to their migraines or headaches. And they were lucky enough that a doctor, a therapist, a chiropractor sent them to have a simple X-ray picture of the connection between the head and the upper part of the spine, where the spinal cord begins, where your brain stem. The brain stem is your body's junction box that not only sends messages from your brain to the rest of your body, but it receives messages telling your body how to react to these stimuli. It tells your heart when to beat. It tells your lungs when to breathe. It tells your body how to digest your food. And certainly it tells your body when it should feel pain. So the upper part of your spine and spinal cord is absolutely essential to have evaluated when you have migraines or headaches of any type. Yet, this continues to be ignored by most doctors, therapists, even neurologists, and headache and migraine specialists. If you look in the wrong place, you're never going to find what you're looking for. Your migraines, your headaches may not be a head problem. It just doesn't matter what kind of treatment, what kind of therapy you try. It just doesn't matter what kind of doctor, specialist you want to see, until you first know and understand the real, true cause of your migraine and headache symptoms. It's as simple as that. Finally today, I have a quote on the desktop of my computer. I keep it in front of me when I'm doing consultations for people around the country and around the world at this point in time. And that simple quote says this: in any moment of your life, a decision you make could change the course of your life forever. And I'm going to modify that quote. In any moment, a decision that you make could change the course of your life or the life of someone you care about forever. Look, I was told for many years, nearly 10 years, that there was not a solution for my migraines, that this was just simply a condition that happened to some people, and that there was no long-term solution, and I would have to simply find the best way to manage my migraine symptoms. Well, according to nearly 80 years of proven, published medical and scientific research, that is garbage. That is garbage. It is contrary and it conflicts with decades of proven published medical research. Again, in summary of the research we reviewed today, specific upper spinal disorders near your brainstem and the upper part of your spinal cord that result in neurological type symptoms, such as migraines, are a frequent cause of migraines and headaches. Please share this podcast with somebody that you know, somebody that you care about, that continues to battle ongoing migraines, ongoing headaches, ongoing pain. Look, there is hope and there is realistic help available for you. If you're willing to look in the right place, and if you're willing to take action and change the course of your life forever. Stay tuned to onlineheadachedoc.com As I mentioned in the last week or two, I have never been this excited about some of the new features and some of the new services that we'll be providing here at the Online Headache Doc in just the next few weeks. We want to help as many people as we possibly can finally find significant, long-lasting relief and improvement from your migraines and headaches. It is possible, it is realistic, so take action today. Thank you for listening. I'm Dr. Scott, your Online Headache Doc, and those are the facts. And everything else, well, it's just another opinion. The information contained in this podcast is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's 32 years in private practice so far, specializing exclusively in migraine, headache, and upper spinal disorders, as well as decades upon decades of proven published medical research. Copyright 2025 by Milagros Media, LLC, not affiliated with Dr. Scott's private practice.